Hey Dandelion Tribe, it's Doc Danae here in the township of Irricana. And in the local rag, I just wanted to read the headline on the front page of the Rocky View Weekly. And it states, Degraded and Helpless, spike in reported abuse in Alberta's continuing care homes. I will read a few sentences from this because, again, they're doing cutbacks in mental health in rural Alberta, thanks to our government, and Danielle Smith is the premier here. She's the one that needs to be held accountable for all these closures of mental health centers in rural Alberta. So in our care homes here in Alberta, this is what is going on. Injury, neglect, malnourishment, death. Documents show increased reports of abuse against seniors or elders in Alberta's publicly funded long-term care and supported living facilities. The Protection for Persons in Care, PPC, program responds to allegations of abuse in Alberta's hospitals, nursing homes, lodges, homeless shelters, addiction and rehab centers, programs for persons with developmental disabilities, and related care and support services. In 2023 to 2024, PPC employees investigated hundreds of reports of abuse. According to its annual report, investigators determined 157 of these allegations were founded, 3 times more than the previous year. 68 of these cases of abuse occurred in long-term care facilities and 26 in assisted or supported living centers. Allegations include physical, emotional, and sexual abuse, but the most common type of abuse? Half of all founded incidents are those categorized as failure to provide the necessities of life to Albertans who have paid into our tax system since they were young, right? So, when serious bodily harm results from a service provider not giving a client adequate food, medical attention, or otherwise neglecting a client's need. Dandelion Tribe, we are in a pandemic crisis, not only in Alberta, but across Canada, because everything's falling on deaf ears when it comes to our government agencies. Danielle Smith came out guns a-blazing when she was first elected. We thought there was possible hope for Albertans. There is not. The local mental health here for rural is being shut down. They cut funding. As of March 31st, the gentleman who runs the office for over 16 years will be losing his job. He's amazing. He's amazing to the rural people that are struggling because the services like community links are a disconnect. I know, I've walked my talk. I've suffered breast cancer and a traumatic brain injury. And what I had to go through to get help was unbelievable. Right? And I know the system because I've been 50 years in healthcare between British Columbia, Washington State, and Alberta practicing. People, we need to get on this, right? The people are going to make the change, not the politicians. The politicians, all of them lie. They're paid, they sleep with, they do favors for all these other organizations. No. We need to protect our elders, our children, and youth. If we're going to make a difference in this province, people start needing to band together to say enough is enough. And Danielle Smith, I've written letters to your organizations to talk to you about this issue, and it was sloughed off. Hey, Danielle, if your recovery programs were so effective here in Alberta, because that's what your office sent out, right? We shouldn't see anyone living on the streets and not having places to live, right? It took me over 3 months to find a place, almost a year actually, when I came back from British Columbia, working the streets with First Nations up there in mental health, addiction, suicide prevention. It took me almost a year to find a place to rent that was affordable, that wasn't $2,500 a month in rural. I can budget for $800 on my income right now because of a medical disability that I've had. So changes need to be made. And I am tired of politicians talking and not taking action. It takes action to make a difference in small communities, especially rural BC. So Danielle Smith, you can respond to this podcast that's going to be posted on my YouTube channel. We're sick of it. We are sick and tired of it. And we are going to take it into our own hands to make a change on the face of mental health, suicide prevention, and addictions here in Alberta, because your government is doing nothing. Nothing. It's getting worse before it gets better, and you think by cutting these programs, you're going to succeed? Oh no, you're going to have a street problem migrating out from Calgary and Edmonton to the rural areas, and you haven't seen anything yet, Danielle. Nothing yet. So I hope one of your croonies does respond to this podcast and this YouTube, but we have elders dying because of neglect of care. And I know for a fact in BC, because my dad was in long-term care, they take 80% of your income when it comes to living in care facilities. So the Hospital Corporation, these publicly funded elder care facilities are richer than rich. And that's got to stop, because care has to be brought back to self-care. We need a wellness paradigm, not a sickness paradigm. Anyways, that's what I had to share with you, Dandelion Tribe. I'm really pissed. I'm choked of what's going on with the people that are the bread and butter of Canada, that have worked hard their whole life and expected with their CPP, taken off their paycheck, that there would be something for them if they needed it, if they got into crisis. There's nothing there. There's nothing. And shame on the Alberta government and all the governments across Canada. Anyways, that's all I have to say. I'll keep you posted on what's going on in Irricana, but we're going to change the face of mental health here. I guarantee it. And that's Dandelion Tribe healing. We're going to do it through integrative care and get some action happening. So I hope you support us. Reach out, message me, and see if you can contribute or help out, because I've got some big plans, but hopefully we have to group together and work as a tribe in order to get this happening. Anyways, over and out. Have a great day, Dandelion Tribe. Happy Tuesday. Bye for now.